Hi, I'm Lynn Antonopoulos reporting for Daily Bulletin. I'm talking with Dr. Mercedes Arias, Head of Diagnostic Imaging for the Public Health Service in Spain. Dr. Arias is sharing key learnings from her RSNA 2024 talk, Effectiveness and Feasibility of Mobile MRI Use in the Public Health System. 18 years of experience, actions speak louder than words. Thank you for joining me today.
Thank you.
Dr. Arias, what unique challenges did you face in implementing the mobile MRI system?
Well, that's a very good question because we were trying to do things differently. So we had to face many challenges when we started with this project. But as you know, beginnings are always hard. But though we had to face many, logistical and technical challenges, those I think were not the most important because we had to thought about other things, different things, such as, for example, the team who was going to work inside the mobile MRI unit, because they were going to stay away from home for long periods of time, and that changed the way they were used to work, for example. And if I have to say the biggest challenge we met when we started, I think it was people. What I mean is, patients and requesting doctors and even hospital administrators were not sure of the quality of what we were going to do, and that I think was the most difficult part of the project.
And what specific factors do you think contributed to the high levels of acceptance and trust that you ultimately had in the mobile MRI units?
Well, I think that from the beginning we were very committed with quality, and I think that was the best thing we did when we started with this project, because we were very careful with image acquisition, so the quality of the images was just comparable with the fixed images they were used to have. And also we had a very high quality in our reports because we were a group of radiologists that had been working with MRI for a long period of time. And I think that helped a lot to trust and to be confident with this new service. Besides, patients rapidly were aware of the benefits of having, the MRI near to where they live. So they noticed that accessibility increased a lot, and also their waiting times decreased a lot. So it was easy to raise satisfaction rates very high quickly. For requesting doctors, I think we did things quite well because we tried to keep in touch with them as much as possible, because we were not where they were working, of course, but and also we tried not to alter the way they were used to work. We just used the same way they were used to work with, and we put our reports and our images inside the health records of the patients just as they were used to work before that.
Right, so adapted to their methodology in their various areas.
Yeah.
And so what long-term impact do you envision mobile MRI systems having on public health systems worldwide?
Well, I think that with this kind of services, you can reduce the geographical barriers. You can improve, of course, accessibility to the technique, and this deserves a higher equity in the access to the MRI. Especially when we are talking of underserved areas or areas with a very dispersed population where it's difficult to get an MRI. Of course, I think you can use this service to flexibilize your healthcare system, because you can use these mobile units to help with fixed facilities in cases of prolonged breakdowns, peaks of demand, and things like that. And you can help healthcare administrators to avoid transferring patients from their hospital to another hospital with this mobile MRIs. And finally, I think we can't forget the impact this has in sustainability, because you avoid a lot of patient traveling to get an MRI.
Yeah. Well, thank you for your time today. For more information about the study, look for this RSNA 2024 session on demand at rsna.org/meetingcentral. And as always, you can find more radiology news at rsna.org/bulletin.